Hi, good morning. So today we are going to talk about the types of cough. I am still your favorite nurse, Ella Mansi, and also your nutrition specialist. So the types of cough, as we discussed in our last video, that we are going to talk about types of cough today. There are different types of cough. As I said earlier, that the type of cough will determine if the parent or the caregiver should panic, and also it helps in diagnosing the cough. So, first of all, we have dry cough. Dry cough is the type of cough where the baby is coughing but nothing is coming out of, there is no mucus, nothing is coming out of the throat. Dry cough is usually caused by viral infections. So when the child is coughing and nothing is coming out, know that it is caused by virus, and it is supposed to relieve the child within 2 weeks, or at least by 2 weeks the cough should be relieving the child. Secondly, we have wet or productive cough. When you say is wet or productive cough is when the child is coughing and there are mucus coming out of the throat. It is productive, and in this case the cough is usually caused by a bacterial infection. So for those who like to give antibiotics, in this kind of case you can give antibiotics to the child, but it's usually good to give antibiotics with doctor's prescription. 3, we have barking cough. We say that cough is barking because of the sound that it makes. It makes a kind of barking sound, or a harsh or seal-like sound. Most of the time you see this type of sound in crops. Crops is a kind of inflammation in children that affects the trachea or the throat. So when this occurs, you know that it is a barking sound cough, and it is contagious as well, which needs medical attention. The parents can panic in this situation because it needs immediate medical attention. Also, we have whooping cough. Whooping cough is also classified as whooping because of the sound it makes, and whooping cough is usually caused by infection as well, which means the parent or the caregiver is supposed to be take the child to the hospital for immediate medical attention. Also, it is highly contagious, so it should be treated, and a child who has whooping cough should not be allowed to stay with other children. So you should reach out to the medical practitioners for intervention as soon as possible. Then we have nighttime cough. Most of the time, nighttime cough is usually as a result of asthma. It usually happens in children with asthma. When the child is sleeping, they wake up in the midnight and be coughing. Sometimes they vomit along the line, and also you can also see it in postnatal drip. Then there are some home remedies for mild cough. When cough is not that severe, there are some home remedies that you can apply as a caregiver or as a mother to the child. First of all, we have steam inhalation. Steam inhalation is when you put hot water in a bowl and cover the child with you hold the child and make the child to inhale the steam that is coming out of that hot water. Please do not keep the child over boiling water. I said when you keep the child over hot water that is in a bowl, you hold your child, you carry the child and cover yourself with the child. The child will inhale the steam that is coming out of the hot water. Secondly, we have saline nasal drip. In saline nasal drop, what you do, use saline and drop in the nose of that baby. It will help to open up the blocked airways so that the baby can be able to breathe. We also have use of honey. In use of honey, you give a child honey. It helps in soothing the throat. Please, for honey, do not give to a child who is below 1 year. Honey is not meant for a child who is below 1 year. Also, keeping the environment clean and free from smoke matters in children cough. Most of us parents, we like to use strong perfumes. We like to apply perfumes, especially mothers with children below 1 year. Please, it is not ideal for us to be using perfume, especially the ones that have strong scents. It can affect the child and cause cough and catarrh in those infants. So you try to keep your environment safe and free from harmful things like strong smells and smoke. This will help to make the child to be free from cough. There are some things you shouldn't do as a mother or a caregiver whose child is having cough. Please, do not give honey to a child who is under 1 year. As I mentioned in the first slide, as a mother or a caregiver of a child who is having cough, there are some certain things you shouldn't do. Number one, you should not give honey to a child who is under 1 year. As I mentioned in the place where I was talking about the home remedies, that you should give honey to soothe the cough. Please, when a child is under 1 year, do not give the child honey. Secondly, do not give antibiotics to a child except it is prescribed by the doctor. Do not give antibiotics to a child who is having cough. Also, do not give cough syrup to a child who is under 6 years. If a child is not up to 6 years, do not give cough syrup to that child. Then do not ignore the choking signs. Men, try to know when your child is choking by the cough. If it is choking, please seek medical advice as quick as possible. Okay, thanks for today. In my next video, we will continue. See you.